Naproxen, also known as Aleve or Naprosyn, has become a very popular medication for both pain and inflammation over the years. In this video, I want to explain two important facts that you should know about this medication to ensure that you're using it correctly. Fact number 1. Dosing for inflammation or swelling. Many people are aware that when you're using this medication for pain, you can take this medication every 12 hours as needed, and there's no dire need for consistency in the dosing. If you miss a dose in this situation, it's not really much of a concern. This changes when you're using the medication for inflammation or swelling rather than pain. In this situation, there's more urgency to stick to the 12-hour dosing regimen. To clarify this point, NSAIDs, or non-steroidal anti-inflammatory drugs, such as Naproxen, and ibuprofen for that matter, must be taken consistently to help reduce inflammation. There's a lot of information in terms of how long you have to take an NSAID such as Naproxen to help reduce inflammation. I was going through some studies online, and some studies do recommend that you have to take these types of medications for up to 2 weeks to get the maximum effect for inflammation reduction. Some other studies also mention that you may have to take an increased dose when compared to dosing for pain to treat that inflammation. Fact number 2. How do you dose Naproxen? The first thing that you should be aware about this medication is that the maximum daily dose is 1,250 milligrams. Some physicians, however, may feel comfortable prescribing a regimen that exceeds this maximum daily dose. So always take this medication as prescribed, or if purchased over the counter without a prescription, just follow the instructions on the label. Also, you should be aware that when patients are using doses of about 500 milligrams, this is when the medication is dosed every 12 hours. And when patients are using doses of 375 milligrams or 250 milligrams, then it can be typically dosed in increments of 6 to 8 hours. Sometimes it's recommended to take 500 milligrams as your first dose, and then afterwards use 250 milligrams every 6 to 8 hours, again with the goal to keep the dose, the maximum daily dose, below 1,250 milligrams. And that's all I wanted to share today with 2 facts about Naproxen. Take care.